Access to quality health care is important, but that doesn't mean it's always available to everyone who needs it. Statistics show positive health outcomes for people of color lag behind the general population. As we celebrate Black History Month here at Boston 25, anchor Rachel Keller talks to the CEO of the largest community health center in Massachusetts. He dreams of leveling the playing field for people who need basic medical attention.
How many locations do you have in total?
We have about 17 different clinical locations.
Greg Wilmot is the CEO and president of NeighborHealth.
So what do we have in here?
So this is our brand new state-of-the-art radiology suite.
It's a network of community health centers that services about 130,000 people a year, stretching from the South End to East Boston and up to Revere. It prides itself on bringing top-notch care to people who might otherwise go without.
Timely access to diagnostic tools is going to lead to more timely treatment, and it's going to ultimately address longstanding equity gaps.
Take breast cancer, for example.
Black women have a 40% higher likelihood of death from breast cancer than white women, although the prevalence of the disease is less pronounced in the Black community. What we were seeing is that Black women were being diagnosed much later than others, largely because of access to cancer screening.
Wilmot's calling to helping others started early in life.
My mother was an immigrant from the Caribbean, came here in the 70s, and was a single mom and raised me and my brother here in this city, Boston. My mother really focused on education and really instilling a work ethic.
From Boston's neighborhoods to Boston College and then graduate school at Northeastern, Wilmot never forgot where he came from. It's a lifetime of experiences he brings to his job every day.
I have experienced firsthand and I see firsthand the challenges that families face when navigating their health care in the city. When we see the prevalence of cancer in the Black and brown communities we serve.
Today, he's got the corner office at a time when only about 6% of all CEOs are Black, according to the Bureau of Labor Statistics.
To the extent that it serves as an inspiration to other people of color, I think that's very important. But it also comes with obligation.
That comes as the organization could be heading into choppy waters. Almost 2/3 of their patients are either uninsured or on Medicaid, and the future of federal funding is murky at best.
It's a tough reality, I think, that we all have to grapple with, but our healthcare system isn't designed to provide high-quality healthcare sustainably to poor people. And that's what we need to change.
Wilmot worries about patients stalling or even foregoing treatment.
What we know is when we can treat people further upstream, when we can serve them through primary care and preventative medicine, when we can get at the social drivers of health or social determinants of health earlier, it's going to help us avoid downstream expensive health care.
The job is challenging and promises to be even more challenging in the days ahead. Still, Wilmot thinks about where he came from and where he's going, and hopes to provide some inspiration for tomorrow's leaders.
One of the things I would share with young people is that when you're doing the difficult work of change, there will be resistance. And I would encourage young people not to be deterred by that resistance. Important sometimes is to lean in and lead through.
NeighborHealth has an emergency room at their East Boston location. It sees 45,000 patients a year and is the 4th busiest ER in the entire city.